Here's the tumor.
The odd thing is that they call me doctor. You want me to pull the wire out now?
No, don't touch a thing.
I don't even know what I'm doing.
Johns Hopkins is one of America's greatest hospitals. These are the stories of the men and women who work there.
I think there's a lot of attending gossip about us.
Personally, I'm going through a difficult time. You gotta get your emotions under control.
You were acting like a boob.
Without a transplant, he will die.
You have a heart.
No way.
We have multiple gunshot wounds.
It's a war zone here.
I don't want to die.
Yeah, well, I can't move. No one's moving. There we go. This is a Baltimore TJ. Traffic jam. A Hopkins physician is somebody who is a pedigreed doctor, meaning that they've been to all the best schools, they've had all the best training, and they're the smartest. And I didn't do that. I sort of came up from below. I'm not really a Hopkins doctor. Hey, go ahead, dry cut in. One of the nurses from the OR. Here, watch, I'll bump her. What's wrong, Holmes?
Hey, I'll sue.
Yeah, I'll sue. Get in line.
That's the right matter to the front desk.
Hello.
Hi.
How are you, sweetie?
Fine.
You ready?
I'm ready.
Okay, we're gonna get this leg fixed up. Okay? To be a good surgeon, you gotta have some brains. You gotta have pretty good hands. But being a good doctor, you also have to be rational, and you have to know how to treat people, and you have to know how to get the patient to trust you. Anybody I need to call? Anybody?
I couldn't get in touch with nobody.
Okay, so it's just you and me, huh?
It's you and me.
Okay.
I feel comfortable with him, and he's somebody that you would think he was just one of us. And that's the way I like the doctors to be.
Okay, Mrs. Jordan, your time is here. It makes it seem so mysterious, surgeons, It's a job. Vascular surgery, right? It's simple stuff. You got a blockage, and you got to fix the blockage, right?
This nice lady is a long-standing diabetic. She developed an ingrown toenail and is complicated by her poor vascular disease.
No circulation, or poor circulation. So she has a couple of toe amputations that aren't going to heal unless we fix it.
We're going to try to revascularize her leg. And nobody does it better in town than Dr. Tom Reifschneider.
Did you report me?
About what?
For using four-letter words?
No. Why? Did you get something?
Didn't it happen the last time you were on the service?
I think somebody said something to the nurses or something. I don't know.
It's the second time.
Patient at this time is completely unconscious, ma'am. There's no painful response, no verbal, no...
It's going to be an innovation. So it sounds like this patient fell down steps and hit their head and is now completely unresponsive, so they may have a head bleed.
80-year-old gentleman is walking up the steps with his wife.
He's going to need a tube, Rachel. You ready? 1, 2.
Smashed his head.
He's got unequal pupils here. He's an 8 over him.
All right, sounds good.
Where's his line?
Right here.
Pharmacy, can we push the Lido, Etomidate, and Sucks, please? Oh, he's got some dentures in.
Can we get a Dexy machine for They're going to innovate.
Got it out.
Okay, got it. Balloon. So we just need to secure it and then
secure
go.
it quickly and go to the CT scanner.
Weird thing is you think that 80's old until I think about the fact that my grandfather's 86 and he's still skiing.
Right. See, it looks like he has subdural, intraparenchymal.
Rachel, I'll go say hi to the wife. I think the social workers are out there.
Just say that he had a really bad head bleed with...
That needs surgical management. I'm Dr. Charnick. Your husband, I know he fell. He was walking with you. And we just got the CAT scan back. And I'm not sure what other injuries he has, but he has a large amount of bleeding around his brain. And that needs to be taken care of surgically. I mean, I assume that's what you want, but I wanted to make sure that you would like him to go get an operation, because that really is his only chance for survival at this point.
He needs to go into surgery
Immediately.
immediately?
Yes.
Okay.
Gotta save him if you can.
Okay. So the neurosurgeons are getting ready to come down and see him, okay? And they're going to take him right upstairs, straight to the OR. When you see someone have an injury like that, it's very unlikely that he will have a good outcome. But I can't think about that in the moment because I have to save him, take care of him, do the right things for him. And then it kind of hits you later. If she's ready to walk in, she can walk in now.
Okay, come on, Miss Dixon.
Her life is never going to be the same, and it happened in just a split second. Everything was okay, and now it's not.
Hey, Miss Jordan, it's Dr. Wright Snyder. Hey, you're just waking up. You okay? Miss Jordan? Your leg sore? Okay, I told you it was gonna be sore. But hey, your circulation's all better, okay? So you can just relax.
We'll take care of it. We'll give her pain medicine.
Good. See you guys. Here at Hopkins, some of the residents are very impressive. You know, like Ariel, who is on my service. Who's the guy that gets all the chicks? That's right, Ariel.
With Dr. Ressner, it's like he's one of us, you know. He's down at our level and just sort of hanging with the boys and the girls, you know, and that's what makes it fun.
This is his French dance partner, which he was bragging about. None of us knew that he was a dancer. And he sort of let it slip one day. And he was kind enough now to share us some pictures that probably will come back to haunt him. And look at him. Makeup, lipstick.
He's done now.
He's a fourth-year plastic surgery resident at Johns Hopkins, and there he is in France, dancing.
When I was little, I actually wanted to be a doctor. I grew up thinking, oh, the doctors are the smart ones. And now I realize that that's not true at all. I've met a lot of really smart nurses and a lot of really dumb physicians.
Okay, Peyton.
We received a call this morning from Cumberland Hospital, and they had a 2.5-year-old, and his heart is very large. So we're concerned that he has some type of infection, or we're not sure why his heart is so big.
When he gets mad, this is Caitlin. Do you want to Hey, you're at the new doctor's. You want to call Mommy because she's coming in the car, and you came in a big helicopter, so you came super fast. If I pick you up for a minute, will you stop crying? Yeah. Okay, come here.
Hi, Melissa. It's Megan, Peyton's nurse. Right now, we're just actually getting him settled in. The doctors are there looking at him. May do the echocardiogram of his heart, the picture of his heart, but they do that right at the bedside.
Hey, buddy. Hey, Peyton. Can I take a listen to your heart? In pediatric cardiology, there is the so-called rule of thirds. Before you know anything more about what's causing the problem, you can predict that a third of the kids will die, a third of the kids don't recover a normal heart function, and a third of the kids get better. The echocardiogram shows very poor function of the ventricle. It's dilated and it's not squeezing normally.
I'm Dr. Ringel, one of the pediatric cardiologists here. I'll just give you my card. Okay. We want to do a biopsy of the heart muscle to tell us if there's signs of inflammation going on. If we see inflammation, that's the best news. About 70% of the kids are going to recover and be normal. If there's scarring, admittedly, that's not good news. That means that the process has been going on a long time and that there's really little or no hope for recovery of function.
Any risks to doing the biopsy?
Absolutely. The heart is irritable, so the risk is of developing an irregular heart rhythm, or I could perforate the heart and make a hole that could be deadly.
And we have 1, 2 is right side mid-axial area, decreased lung sounds on the right.
Okay, he had access. That's a past tense. Your belly's hurting you? Yeah. That's fine. Open your eyes.
You have any medical problems? Are you on any medication?
Sure. What's your name? So left chest.
You have vitals yet, guys?
Left abdomen. Gunshot wounds, stabbings, beatings. It's a war zone here. Patients walk in off the street. If they're unconscious, you know nothing about them, except for what you see and smell and hear. Not everybody's comfortable with that.
Gunshot wound to where? Come on. Chest and what? Two left sides, one to the left wrist. I don't see any. No blood.
Hold your hand real still, okay?
They can't really see the larynx because the bullet is obscuring their view, and they're concerned about injury.
Anything else hurting you? No.
Right wrist is shattered. His carpals are shattered, and he's got a bullet sitting right where we saw that over the thenar eminence, sitting right there. He was just walking up the street.
Chewing on a tuna fish sandwich, okay? There's always going to be a tuna fish sandwich involved here.
Why tuna fish sandwich?
Because that shows that he has nothing to do with this. So here, I'm walking up the street, chewing on a tuna fish sandwich, minding my own business.
It's like something well known?
Yes. So he probably might be collateral damage. He might not be the target. You have other guys who have wounds.
No, he has a body shot.
Body shot too?
Yeah, he's got a chest tube. A right
Doesn't
chest
make him a
tube.
bad person. But the main thing in the end is he's probably, yeah.
He's got actually a couple body shots, but I mean, he's also got the right wrist and
So,
right
so we have
ankle.
4 hits altogether?
So there's so many holes, I'm not sure.
So many holes.
Yeah.
Doesn't make him a bad guy. But they're also, by the way, high-powered weapons. I mean, these are not 22s. These are big bullets.
I don't know what kind of gun can do that. I don't know. I was from West Virginia, I should know.
Our 2.5-year-old Peyton is going for a biopsy today so we can figure out why his heart is so big.
Take your rest. Close your eyes and rest. Love you. I love you with all my heart. I love you with all my heart. Take a little nap. Good job, man.
Can we give him a little bit of atropine, please?
Heart rate.
Yeah, we have a change in rhythm right now. Can we get some?
We got a sat of 100%. We got a heart rate of 87. Okay.
You got 89, 88, you have 181.
What the hell happened?
Have a pulse. Why don't we start?
You want to tell me what happened, please? Holy mackerel.
I do not have a pulse on this side. Wow.
There's your picture, Rich.
Yeah, we're not getting much of anything. Come on.
We're on Effie. Do you want dopamine?
Yeah, tell me when 2 or 3 minutes is up, whoever's recording. Just stop for a second, please. See if we have a pulse.
Yeah.
Got a pulse.
Yeah.
Got pulse, nice pulse.
We have a good rhythm on here.
So the pressure is 130 over 100. Okay.
He's back in his own rhythm with a decent blood pressure, so we're okay. But obviously, this is a substantial setback. Holy mackerel.
We just want it up.
Has someone notified the parents of what's going on?
It's okay. It's okay. 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 Listen, what happened when he underwent induction and the anesthesia, he had what we call an arrest. His heart wasn't able to pump hard enough. Reaction to the medication, most likely. We're established chest compressions immediately. His heart is back pumping now.
I'll wheel you up to the ICU.
You're going to get a little incision right across there, like that. And we're going to take this vein, which is your cephalic vein, and we're going to swing it over and we're going to hook it into the artery right there.
Oh, okay.
It'll take about an hour, okay?
Yeah. They told me 2 hours.
If we can use this vein right here, it'll only take about 45 minutes.
Oh, good, good, good. Good job, good job.
So what did you do last night?
Talked to my 22-year-old French girlfriend.
22-year-old.
Salut Candy, c'est Ariel. Je voulais juste demander si tu peux me rappeler dans 30 minutes, si tu peux. À tout de suite, ciao.
Oh, that's so cute.
Money.
You misstated a little bit. She's not 22-year-old French girlfriend. 22-year-old French acquaintance.
How would you know?
You told me.
Knife.
Here we go. When I was growing up, I always had the sense that dancing was all just sort of foreplay.
Mm-hmm.
So, what percentage of dance partners you've had have you been romantically linked with?
Oh, Jesus, the inevitable question.
Here, come on. Keep going. Nice vein. That's a fair question, isn't it?
How many of your dance partners do you have sex with?
I didn't say that. I said you
Basically.
No, I said that you were personally involved with.
I can't handle your directness.
Man, that's a beauty.
Money.
That's a beauty. We're gonna. I think I would take it up to the last inch. You gonna answer my question or not?
What?
About the romance in dancing.
Yeah, it happens.
Does it cause conflict with the dancing?
It does. It's like having two intense relationships that all rolled up into one. It's painful sometimes.
How did you pick dance?
I majored in engineering undergrad.
Oh,
so I had
engineering and dance goes together?
No, I'll get there. I'll get there. You want to finish the story?
No. I just, I didn't think dorkiness and dancing went together.
Well, sometimes they do.
We should find out if someone has looked at this the cardiac MRI. We don't know how much damage has been done, and there is some disagreement as to whether we can save the heart or not.
He's 15
In
kilos.
my opinion, we should just let the child die. But ECMO would be a bad idea. But I suspect I'm the minority here.
Why would you say that? We don't have the biopsy back yet.
Correct.
If the biopsy shows that he's got acute myocarditis, then we could ride him through this storm. Now, if it shows that he's got, scar there, well, yeah, then we've got a problem.
What do you think the biopsy is going to show?
I agree that this is likely to be old.
To learn more about heart disease, go to hopkins.abcnews.com.
Yay, I'm on vacation. Thanks, Joy. So excited. Honestly, but I can't help but looking in here first.
Do you feel the same? You wanna get away?
All right, that's enough. Time to go home. This is awful. The weather is awful. The roads are awful. I should not have trusted the Weather Channel. Oh, did he just slide? Oh, oh God. You got to slow down. I just don't want to.
You're scared. Just close your eyes.
No. Will, way too close. Back off, or I'll drive. Oh. Oh. I don't want to see this. That's really bad. Oh my God. This is Bluefield, Virginia. This is the tiniest little place. That's our jeweler. Here's the bank and the post office and a little woman's shop. And that's it. You're done with Bluefield, Virginia. Woohoo.
Why don't you folks take a seat? Dr. Berkowitz, Dr. Richella, and Steve.
We really weren't expecting this. This is very difficult.
It's a very, very difficult time, and what we would have hoped is that we would have had time to be able to sit down over a period of days and talk about this. But Peyton, his heart was not pumping well at all. We don't know the cause of it, but it seems like this has been some chronic process that's sort of slowly gotten to this point where he is what we call in heart failure because his heart is just not squeezing properly and not pushing out enough blood.
What kind of things should I have seen prior to this?
Don't second guess yourself. You guys are obviously very loving and caring parents. You did what you had to do. You brought him here. Don't Don't think about this as a failure of recognition of things. Kids have an amazing way of coping. Unlike adults where, start having, a downward slope, they compensate for a long period of time. And then, boom, they decompensate rapidly. And this is what happened here.
His blood pressure is really not as good as we would like. And we're moving to the next phase of other options that we can offer.
Is there hope?
There's always hope when there's different options. Cardiac transplantation is a very good option, okay? It unfortunately stems from a tragedy somewhere else. But the results are great, especially in somebody like him who's not had previous cardiac surgery, okay? When things go well, they go very well. And it's a hope for a child like this for a long life.
One issue that I raised with you, and I think we don't like to think about it, but I always mention to parents is that, the option of, and it's always within your right, not to proceed.
But what I'm understanding is if we don't proceed, it's not good either.
Well, we may well be in a situation that if we don't proceed, that he will not make it and he will die from this complication.
I mean, this has really hit the family like, brick out of the sky. From one day to the next, you're on a bed talking heart transplantation. It's a lot to think about.
Hey, yeah, 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 yeah.
I feel very attached to this land, and I feel attached to my mom's house, and now it's kind of my retreat from the rest of the world.
Anne was the hardest kid to raise you could ever possibly imagine. She was so stubborn, and she was so, she was just so headstrong.
I was always grounded.
She was grounded most of the time she was in
Most of my life, I was grounded. My mom is my best friend. I talk to her like every day. She's generous and she's unassuming, and she'll give you the shirt off her back. I aspire to be like her, and I can't do it. I'll never live up to her. You're gonna have to help me answer this. Have I, Mom?
About what?
Like, ever fallen head over heels in love with someone? I don't think so. I don't know, I just have this feeling that when I meet the person I'm supposed to marry, I'm just gonna know it.
I love the girl with the golden hair, and the Tennessee stud loves a Tennessee mare.
In med school, I did have a relationship. I was engaged to him, and it was about 3 months before the wedding when I broke it off. I was 23. That's young. You just are not who you're going to be at 23. And I think that's why I think now is a better time to meet somebody and get married.
Whistle when I go. Oh, let her blow. Oh, let her blow.
I got a smile this morning, and he started trying to eat. This is popsicle number 3. And yesterday I got 2 kisses, so I'm doing pretty good. I'm feeling better.
Peyton is doing very well, remarkably well. It's a miraculous recovery with the medication, but we know that his heart is severely damaged, and he will not get better unless he gets a heart transplant.
You see him on the outside, running around, have so much energy. It's hard to believe that he's that sick on the inside. You just don't want to believe it.
So I went and looked at the echocardiogram from this morning, and what it shows is basically the same as the one we had at the end of last week, and pretty much the one before that, severely depressed function. So since we haven't seen much improvement in his function, we should go ahead and list Peyton for a heart transplant.
So we're descending again.
See you later, buddy.
At first, I tried to think ahead, and that's just too boggling on the mind, so we just take day by day. That's all we can do.
Hello? Yeah. Listen, so it's going to be a go with the transplant with Peyton. I'm actually entering the hospital now, and I'll I'll leave from here at 2. Just gonna go to the PICU and talk to the parents. Let them know we have a heart. So it's a go. We have a heart, and we're gonna go in about an hour. We're gonna leave. All right? So I'm very happy. You know, it's very simple how to protect the heart. The heart's a piece of meat, so you put it in the fridge. And that's what we're gonna do. Off we go.
He's gonna get his heart, Mommy. He's going to get his heart. Doctor's going to get it in an hour. You just stay there and pray.
Hopkins continues.
Hello? Are you decent? Let's see. Let's see it. Oh my God, why are you putting a big and you got a tiny little dot there? You should put a Band-Aid on it.
That's a wound. Everything I have is nothing to him.
You put 3 feet of incision on people and you have a 1/4-inch wound, as you call it. We gotta get you ready for bikini weather.
You got that right. I got pretty underwear on too.
Yeah. Victoria's Secret, huh?
Not quite, just a little bit more on it.
Do they call that underwear or do they call it a girdle?
Mine is underwear. Oh,
Matches your underwear.
Band-Aid treatment. And I go in to the swimming pool.
Yeah.
Hot tubs?
Hot tub, no.
That's where the men are.
Yeah.
You're not helping me one dang bit.
I'll see you in 3 weeks.
I love him. Dang it, I love the guy. If I didn't love him...
Okay, Weaver?
Why do I love a guy like that?
I sort of come in the back door mid-career. I don't have a family, and it was time to get out of Pittsburgh. Plus, the fiance didn't want to come back to Pittsburgh, so that sort of helped make the decision easy. First marriage, totally different. You know, totally different outlook on life. Second marriage, I was pretty happy about things. I don't think she was.
Well, we're back, and it's very, very frustrating. When we got there, the child already had arrested multiple times. Basically, we just witnessed a heart die in front of our eyes. That's all it was. I mean, there was nothing I could do. Hey, you know, I was doing CPR on a heart that should go to make him better. That to me is a no-brainer there. Maybe we'll get another call in the next few days, and that's what we have to do.
It was our false alarm. They said they couldn't keep the heart in rhythm. So...
Now we go back to a child that I sure hope is not going to die while waiting, because every chance that you lose here may be the last one.
So Lily came out and looked at this earlier. Just loves the view. And there's a sunroom on the top, you know, on the deck floor.
Every night when it gets dark, you slip into my room. You love me in my sleep, and you take all that you need.
My friends keep saying, well, you need to settle this thing with Lily, and what they mean is you need to get married. You know, Lily and I both, at least I assume that she thinks the same way I do, is, hey, we're together. You know, getting married is just an excuse to having a party and go on a vacation. And also, if she wants to have a kid, she doesn't want to have a kid until she's married. If Lily wants to have a child, I'll go along. I think I'd be a good father. I think it'd be entertaining for both the child and for me. We're gonna go look at a condo, because I've been renting for 1.5 years. The builder yesterday got a little nervous. I said, can I just take a peek? And he said, no. I said, just so you know, I'm not a bad guy. I work at Hopkins. I'm not, you know, I'm not totally sleazy.
Have you seen it?
No. I was waiting for you.
So this would be the deck area for this end of group.
pretty amazing.
Yeah, this is actually the highest point.
This unit, you walk in, you say, wow, has a wow factor to it.
You don't like lofts?
Oh, I love the loft here. Perfect for empty nesters.
We'll definitely pay more for this place.
People always think physicians have tons of money and stuff. And it ain't true. Okay.
Well, we're gonna write you a check.
Okay.
2,500, right? It always, the writing always gets real jiggly when I write checks.
Oh, okay. We're actually on our way to get a heart for Peyton. No, we've had multiple calls on him, but this one sounds like a pretty good match, size-wise, age, everything.
Yeah, we were at this stage before, and we got excited too soon.
The shorter time that the heart spends in the bucket, the better it is. You know, there's been procurements that go beyond, 5-6 hours.
We'll get your new heart, okay?
We'll be here waiting on you.
Peyton.
What?
Love you.
We've given him enough that he's not going to remember this.
We're gonna take real good care of him, okay? So we just finished procuring the heart. It's time to just, put on some speed and go back to Hopkins and implant it in Peyton.
Just incredibly beautiful heart and very smooth, and it was awesome. You should be pumped. You should be pumped.
So we have to start opening the chest probably in the next 15-20 minutes.
This is real. Now it's really happening. This isn't a fire drill this time.
We just opened the breastbone, so now you can see the heart after you open the sac.
Leave me right underneath this bridge here, right behind this truck. Yeah, right here. Let's go.
Come. I'll meet you up there in 2 minutes.
Let's go on, please, Larry.
All right, going on bypass. Going on. Well, right now the machine is taking over the function of the patient's heart and lung, basically.
We are almost committed, but not quite.
Okay.
All right, thank you. You're just saying that they got the heart about 10 minutes ago and they're starting the transplant now.
Hey, here we are.
All right.
How's it going?
So far, so good.
Excellent. Where's my f***ing light? Oh, here. Looks like a good size match, too. Okay. All right, guys.
Blicetti, let me look at your feet, okay?
You're talking about that's my toes.
I know. Looks pretty good. We saved 8 of them.
Well, what did you do with the other 2? Just throw them away?
They weren't alive.
Oh, okay.
Remember? Yeah. Can I ask these guys a question so they can learn a little bit?
Go ahead.
So what blood work? What shows up in blood work when somebody has atheroembolism? Oh, man, that's so disappointing. I'm so disappointed in you guys. Something on the CBC.
CB, what the are we doing here?
CBC, that's called a complete blood count.
Eosinophilia?
Eosinophilia, exactly. Jeff. All right.
I've been in this hospital a year and 3 months. But
His feet look great. Compared to where they were.
My toes will be all right. I can put my socks on.
Yep.
And that's it.
Yep. You're doing great. Tell Louie I said hello.
Him.
Louie's a good man.
What the you talking about?
Louie took
He
it.
left me here. So who the are you trying to bullshit? You trying to him and him?
Oh, I'm not trying to get you upset. Hey, Blicetti, gotta go. Got other people to see. Take care. I'll see you in 6 months, buddy.
Okay, he's a good guy.
Great. Heart. All right. Okay, a little bit of ice, please. In about 1 second, we're going to drop the heart down. 20% down, I guess. All right, next. Same stitch. Okay, right now, ready? 1, 2, 3. Clamp is off. You can have a lot of people will tell you that they will never get used to that moment after you take the clamp off. And you see the heart stop and then start again in a new human being. That's just beautiful. There's a huge amount of emotion when that happens. There cannot not be emotions there. Because the heart is on its own, it's beating very well, and we just have to close, mount things up a little bit and then go to the unit.
Hello? Okay, thank you. Bye. The heart is in and he's off bypass.
Oh, blessed mother.
That is quick. It's quicker than he thought it was going to be.
That's it. All right, babe.
No matter what happens today,
Okay, let's go talk to the family.
we got tomorrow.
We're done.
No matter what happens today.
Thank you. Oh, thank you, doctor. Thank you.
Good. All right. Good. Well done, ladies. Really. Good night. We're going to bed.
Thank you so much. I'll never forget you.
These are the things about our job that I think are great. It's 2 in the morning, and we give hope to a family. And this is what, why I wouldn't change my job with anything else. As painful as it is sometimes. And it is painful. Okay.
To hear more of the music from Hopkins, go to hopkins.abcnews.com.
How much I love you.
The dancing queen. He is the dancing queen. Do you know the lyrics?
A little bit, but I mean, it's been so long, man. I mean, I remember something about watch that scene and it's a dancing queen and, that type
Yeah, come on, before you go to sleep, I need to know them. You can dance, you can jive, having the time of your life. See that girl, watch that scene, digging the dancing queen. Google's wonderful. Your cell phone. So we're going to get to hear it beep every 2 or 3 minutes? Beep. Just because your mom wanted to talk to you?
I am in touch with my family.
Is there any possibility you can hand your cell phone off?
Serious?
I hate that occasional, 2-minute beep. You just like it because every time it beeps, it makes you realize that your mom's thinking about you. Mama.
Yeah.
Not an easy carotid.
Thank you, dear.
Hoping for a little nice, easy one.
Yeah, are you happy, sir?
Thank you. Bobby. Pull a little bit. Can you take my pager? I think it went off. Can you just open it up and see if it...
Who was that from?
Call your mom when you get a break.
What? Call your mom when you get a break.
Do you see that?
Guess who called me on my phone? Not mom.
Huh? Not mom?
Not 22-year-old French girl.
So you should feel a little lost, shouldn't you? Your mother doesn't care about you.
Who's mom?
My mother. Your mother doesn't care about you. I hope Mom's okay. That's the first time I think she's ever called.
Hello? Hi, is this Mom?
Yes.
Say hi to your son. He's in the operating room.
Is he really?
Yes.
Well, I'm sorry to interrupt him at all. I just wanted to talk to him as soon as I could.
Hey, can you call that 22-year-old, please? Put her on speaker. You ready?
Today, Peyton has been discharged, and we're going to be heading out.
Bye. Did you get balloons?
Tell her bye.
Bye.
Bye, Betsy.
Best wishes.
Thank you. You wouldn't know you just had a heart transplant. He just looks like a normal toddler. This is the way we prayed him going home would be.
Are you going home in the car? Tell him.